Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Nanette Santoro. Welcome. Please tell the women who are listening to us who you are.
Welcome. I'm Nanette Santoro. I'm professor and chair of OBGYN at the University of Colorado School of Medicine.
So we're talking about a concept that sounds great, but I think often lacks sort of the definition of what it is we're talking about. And it's that notion of wellness for midlife women, perimenopausal women, postmenopausal women. So as a woman, looking to you, let's say as my healthcare provider, what is it that we're talking about when we talk about my sense of wellness?
Well, I would say that in my patient interactions, there's a glow that people who are well have, that have a positive outlook. And what I see in my menopausal patients is that glow they can start to lose that glow. And they come in telling me that. And that's what we want to get back. And that's the positive outlook, looking towards healthy outcomes and not just looking at avoiding unhealthy things.
So it seems to me that the notion of wellness is different than primary preventions, which is what so many healthcare practitioners excel at. They want to make sure that we're looking at your diabetes and your cholesterol and your blood pressure and all of those big preventions as women lose their estrogen and march on into menopause or bone health. But wellness isn't just primary preventions, is it?
No, it's more than that. So after a doctor gets through those pieces, your visit time is very short. And there's not much time left to address the other things. But this is where I think patients can do some self-advocacy and point out if they're not succeeding at some of these preventive strategies, what are the barriers? And how can those barriers be addressed? Are there ways to do it? For example, there are different medications that can be added for women who are trying to lose weight or prevent more weight gain as they go through the menopause. They may want to ask for those. It may be something that you can, push for a little bit more. I have seen some patients be dismissed because their body mass index remains normal, yet they've gained quite a bit of weight. And we know that's still not good for them. That's a change that's not beneficial for them. What can they do? How can that be addressed? Rather than allow that to be dismissed, those trends can be picked up. I don't like the direction this is going. I used to be on a more positive path. How do I get there?
So that's interesting that you say that. So is wellness also a state of mindfulness?
It's very much so. It's a state of looking ahead with, again, that positive outlook. There's the disease model we kind of consider fear-based. So if you're afraid of a disease, a perimenopausal patient may come in because her father had Alzheimer's and she's worried. She's having a little bit of a memory problem, and that's a fear-based visit. So how do we address that? First of all, what's the problem? Perhaps it's just a little bit of word recall, which we know is normal, so that woman can be reassured. This is a completely normal thing for perimenopause. That's going to get better once you finish the transition. May not go back to where it was before, but it's definitely going to get better. Let's talk about your long-term cognitive health. How do you maintain that? And ways to maintain that are going to be very different than just addressing that fear of Alzheimer's. That's going to include exercise, that's going to include some diet, that may include some mental exercise work. That are all going to be things that can be bundled to help prevent that.
So how do women best address, and does it change, firstly, for menopausal women in terms of what we would consider wellness for menopausal women versus a younger woman?
I think it changes in a way because menopause is a crossroads for women, and it's a time when they can really take an assessment of their health and take a broader look. It's also a time where women are really subject to a lot of forces that can erode their sense of wellness, and not just physically. So the physical stuff is often what'll bring a patient in, but then as you talk more, you find, she's caretaking for someone, an elderly parent or in-law. There's other problems. There's some social issues. She may be feeling isolated. And those issues together are not going to make any of the other, that's not the way to maintain health. So,
okay, so for our women who are listening and beginning to embrace this concept, because it is a novel concept, how best can we, as patients, women, perimenopausal, postmenopausal, begin to adopt a wellness mindset, if you will?
I think there's several different ways to do it that are evidence-based. There's many places that have integrated medicine where there's offerings. I know we have one in Colorado. You can offer women a variety of evidence-based practices that may be helpful. Meditation. There's different forms of traditional Chinese medicine that don't have as much evidence, but they may provide some social connectedness. There may be other things that are helpful in those in that kind of an environment, and there are some group supports that can be done as well.
So the message I'm getting for you and for the women that we're learning from you is that wellness is much more than the traditional notion of what health is.
That's correct. It's staying healthy, and the idea is to have what we call a health span and not merely a lifespan.
And on that, I'm going to repeat that one more time because I think that's such a brilliant piece of advice, the notion of a health span. Thank you so much for joining us today.
You're welcome.